and thank you. I am truly honored and humbled to be here this morning. Today, I am going to tell you one of the best kept secrets in public health. This secret has the power to transform not only how we understand, but how we approach the leading causes of morbidity and mortality. And tomorrow, I hope that you'll share this secret with at least one other person. Now, we're at a college, so let's start with a quiz. Who can tell me who these people are? Anybody? Watson and Crick. How about the woman? Anybody know? Rosalind Franklin, and that's a story for another day, because the three of them together in 1952 discovered the structure of DNA. It was a breakthrough that helped us understand the role that genes play in our health, and it was probably one of the biggest health revolutions of the past century. How about these two guys? Anybody know who they are? I know I have a couple shills in the audience. Okay, these are doctors Vincent Felitti and Robert Anda, and they also had a breakthrough discovery. Theirs was about how experience, the role of experience, and in particular, adverse childhood experiences play in our health. And their discovery has the potential to revolutionize health in this century, but far too few of us know about it. Their story begins back in the 1980s when Dr. Felitti, who is the gray-haired gentleman on your left, was an internist at Kaiser Permanente in San Diego. And among other things, he ran an obesity clinic, which by many was considered very successful. Lots of patients lost lots of weight and improved their health outcomes. But Felitti was not satisfied with the outcomes because he was very perplexed by his observation that about 50% of the patients in the program dropped out of the program when they had nearly completed it and were still successfully losing weight. He couldn't figure out why this was happening. And he was even more distressed because many of these patients would show up back in his practice several months later, having gained back the weight they had worked so hard to lose. In his own words, this was driving him crazy. So in his effort to understand what was happening, he began to ask his patients a series of questions about themselves, about their lives, about when they began to have problems with weight, about their behaviors, about their health histories, and he began to listen to them. And what he learned stunned him. Many of these patients divulged that they had been sexually abused as children. And they also told him that their relationship with food and their weight gain were coping strategies that they used to protect themselves both emotionally and physically from the abuse they were suffering. Well, this really made him stop and think. Now, at the same time, across the country, Dr. Anda was an epidemiologist at the Centers for Disease Control, where he was doing research and becoming interested in how mental health disorders like depression and despair affect physical health outcomes such as coronary heart disease. Well, Felitti and Anda met, and together they began to wonder what other health problems might be traced back to early childhood adversity and trauma. To answer this question, they devised the Adverse Childhood Experiences Survey and Scoring System. The survey asked midlife adults whether they had experienced any of these 10 events before the age of 18: regular physical or emotional abuse, any contact sexual abuse, physical or emotional neglect, living with a parent with mental illness or substance abuse problems, having a household member who was incarcerated, having a mother who was treated violently, or having parents who were separated or divorced. Any yes answer gave people a 1 point or an ACE score of 1. So for example, if you had been regularly physically abused, had witnessed your mother being hit, and had a father who had alcoholism, you would have an ACE score of 3. 17,000 midlife adults answered this survey, and their answers were linked to additional questions about their lifestyles, their behaviors, and their health histories. Well, what did the survey show? On the one hand, the data tell a simple and powerful story. On the other hand, the implications of it are mind-boggling. In fact, Anda said, when he first saw the results from the survey, they made him weep. Because what they first found is that ACEs are very common. Only 1/3 of the adults surveyed had 0 ACEs. Second, they found that ACEs rarely occur in isolation. Most of the people who had a positive ACEs score had 2 or more ACEs. And third, and most distressing, they found that ACEs are highly correlated with poor health outcomes. And the more ACEs you have, the higher your risk for just about every social, mental health, and physical health problem that you can imagine. Things really start to get serious with an ACE score of about 4. I'm just going to give you a few examples. Compared to people with 0 ACEs, people with 4 ACEs were 12.2 times more likely to have ever attempted suicide, 5.5 times more likely to have missed 14 days of work in a month due to mental illness, 2.5 times more likely to have a sexually transmitted disease, and 2.2 times more likely to have heart disease. If you have 6 or more ACEs, compared to a person with 0 ACEs, your life expectancy is shortened by an average of 20 years. Now, this is one of Dr. Anda's favorite slides. He uses it to show how ACEs are almost like a messy oil slick that spreads out over a number of indicators of poor health and well-being. But he also uses this slide to show not only the magnitude of the problem, but the magnitude of the solution that ACEs represent. So imagine if we could mobilize a social movement nationally or maybe internationally that built awareness and outrage about the impact and prevalence of ACEs. Imagine if we could align our efforts, both policy and practice, with the science of ACEs. We could create solutions that could almost act like a sponge, soaking up this oil slick from the middle of this chart and dramatically reducing the incidence of so many problems that cause deep suffering in many of our families and communities. Well, how do we do this? We know that many of our communities have a wide array of services that are designed to address ACEs and the problems associated with them. However, in far too many of our communities where vulnerable children and families are seen, these services are siloed, they're fractured, sometimes they don't even exist. Some focus on prevention, others on intervention, others on treatment. Some are there to protect children, and others are there to punish adolescents and adults. But what if our service system looked more like this? And all of them were aligned around the ACEs, and all of them together had a unified mission to focus on preventing, intervening, and treating ACEs and the associated problems. We would have a much stronger base from which to truly grow a culture of health and resilience. Well, the good news is that in some places, this dream is already becoming a reality. In 2013, Philadelphia hosted the first national summit on ACEs, which brought together 150 experts to look at the practice, policy, and research implications of ACEs. And what we found is that in a number of communities, there are already being partnerships, and Edie talked about the importance of partnerships. There are already partnerships being built across those systems that I showed you in the previous slide, and they are working to forge community solutions to reduce ACEs and promote resilience. Let me give you a couple of examples. In Walla Walla, Washington, there's a community organizer by the name of Terry Barilla. She learned about the ACEs from a speech given by Dr. Anda, and she returned to her community, and in 2010, she started the Children's Resilience Initiative. She talked to everybody that she could find about ACEs, and eventually she was able to gather a committed group of 25 people representing many of those systems that I showed you, and together they created a shared vision and an action plan and got to work mobilizing at the local level. Terry said she knew that they were making progress when after 2 years, a survey showed that there was a 5-fold increase in community awareness of ACEs. In 2012, Philadelphia established the Philadelphia ACEs Task Force. It's co-chaired by 3 physicians, a psychiatrist, and 2 pediatricians who work for 3 large, sometimes competing health systems but they came together because of their shared commitment to think about how to apply the ACEs in pediatric settings. Over time, they realized they needed to broaden their focus, and so today the task force meets quarterly with representatives from health, but also child welfare, juvenile and adult justice, education, as well as policymakers, researchers, and local funders. The group has conducted its own urban ACEs study. They have established a virtual community called the Philadelphia ACEs Connection Group, which is part of an international virtual community that you can join called acesconnection.com. They've recently set out their vision and established 3 priorities to focus on over the next year. And they are hosting a series of informal face-to-face gatherings we're calling ACEs meetups to engage an even broader spectrum of ACEs activists, including students, young professionals, and community residents. These are just a couple of stories. You can find more stories of communities that are working to mobilize around the ACEs that are chronicled in the Community Resilience Cookbook, which was just released by the Health Federation of Philadelphia and the Robert Wood Johnson Foundation. The cookbook has lots of great information about the science of ACEs and about resilience, as well as in-depth stories of 9 communities that have brought together collaborations and coalitions and are working on shared strategies to reduce ACEs and promote resilience. Well, I was asked to leave you with a call to action and one thing you can do tomorrow. And really, they're the same, and it's very simple. Now that you know about ACEs, share the secret. It's the first step you can take to mobilizing action in your community. ACEs are today's reality, but they don't need to be tomorrow's legacy. Thank you very much, and I look forward to dialoguing with you throughout the day.